Hello. If you don't already know me, I'm Danielle Rem. Today, I'm going to be going over sickle cell disease. By the end of this video, I hope that my viewers will understand sickle cell disease and how it's caused, what it is, statistics of it, and treatment options. Sickle cell disease is an inherited blood disorder. Both the mother and the father need to carry this defective gene for a child to be born with sickle cell disease. A child can also be born as a carrier. This is when they only inherit one of the defective genes. When both parents of a child carry the gene, there is a 25% chance for this child to be born with sickle cell disease. Now that I've explained how sickle cell disease is inherited, I bet you're wondering what exactly it is, other than an inherited blood disorder. Sickle cell disease is a group of inherited blood disorders. Normal red blood cells are round, like this. You can see that it's round, of course. They're easily able to move through the smallest of blood vessels, such as capillaries. When someone has sickle cell disease, their blood cells become a sickle shape. A sickle shape cell kind of looks like a C rather than the normal round. So, for example, this is kind of what a sickled cell would look like compared to a regular blood cell. As you can see, it's kind of got edges where it could get caught on things, and that's something important to remember. So, the shape of the cells is called a sickle, for the reason that it looks like a tool which was known as a sickle. So the shape of these cells cause them to stick and get stuck in the blood vessels. This can cause blockages and stop the flow of blood. These cells also tend to lyse or die a lot more quick than a regular blood cell would. Regular blood cells, these nice round guys, live about 120 days, while the sickled cells only live for 10 to 20 days. Another issue with the shape of these cells is they're very poor at carrying oxygen. Sickled cells are marked by an abnormal hemoglobin. This abnormal hemoglobin is known as hemoglobin S. This causes an abnormal iron binding site for oxygen, rendering them to be poor at carrying oxygen, as stated before. So, as you know, before I was talking about how these sickle cells get stuck in the walls of the vessels and can clot the vessels. This is called a sickle crisis. A sickle crisis is a painful experience and can last hours or days. The pain is caused by blood being unable to travel to specific organs, muscles, or bones. For those enduring it, it can be a very painful event. So, since we've already started talking about some of the symptoms and effects that sickle cell disease can have on people, let's talk about a few more. A very common symptom of sickle cell disease is anemia. The sickled cells in a person's body have very short lives and die quickly. Sorry, my cat is trying to steal my props. So, as I was saying, the sickled cells in a person's body have very short lives and they die rather quickly. So, this quick death and the quick death of the cells will cause there to be a lower red blood cell count in the body. So this causes sickled cell patients to feel faint, short of breath, dizzy, and basically every symptom that anemia has, including when you stand up, getting kind of dizzy, getting that like weird head rush and everything. So, and then now there are a few more symptoms. So sickle cells can also cause acute chest syndrome. So this is when the sickled cells cause a block in the tiny vessels of the lungs. It causes a cough, pain, and sometimes fevers. This can happen due to dehydration, infections, or fevers. So if you know much about blood, there is a certain amount of water in them, and when you get dehydrated, that goes down and causes your blood to become kind of a little bit thicker and everything. So you can understand how having thicker blood and less water in it, with cells shaped like this, how they would get caught a lot more easily. Along with damage to the lungs, the spleen can also be damaged whenever by sickle cells. This can be caused by pooling of sickle cells in the spleen. This can cause the spleen to become enlarged and possibly get scarred and damaged. Some of the effects of sickle cell disease are also jaundice and strokes. The reason that people with sickle cell disease have jaundice is due to the dead cells. These little guys who die real quick. Dead cells in the body increase the amount of bilirubin. Bilirubin is the cause of jaundice. Sickle cell disease is most commonly diagnosed in childhood or at birth with blood tests. Now that we know a little bit more about this blood disease, I bet you're wondering, who does it impact? Across the globe, it impacts millions of people, and around 100,000 in the United States. The largest portion of those impacted by sickle cell disease is the African American population. About 1 in every 13 African Americans are carriers of sickle cell disease, and 1 in every 365 African Americans have it. The lifespan of people who are diagnosed with sickle cell disease is about 38 years for men and 42 for women. This does not mean that people with sickle cell disease cannot live a fulfilling life or live longer. There are treatments for sickle cell disease and ways to improve how people are feeling. A lot of the treatments are treating your symptoms, taking medicine for pain, that kind of stuff. But there is a sort of cure for this. Blood transfusions can make a huge impact on the quality of life. So blood transfusions will dilute the amount of sickle cells in the blood and lower a person's risk of all the symptoms I've listed above. So having more healthy cells, the nice round guys that can slide throughout the blood vessels, they make it so oxygen is easily spread throughout the body. Now, when I was talking about a cure, I was talking about bone marrow transplants and stem cells. They have been shown to increase people's lifespans and even get rid of sickle cell disease for some. It is a very risky procedure, but it can be worth it in the end. Thank you so much for listening. This concludes my presentation on sickle cell disease. I hope you enjoyed and learned something. Have a nice rest of your day.